If you're hypermobile and you have hip, knee, ankle, or foot pain, I'm going to show you one of the most cost-effective ways to improve your balance, strength, and decrease pain, all with a few simple exercises. One of the most important things when we're going through rehab with hypermobility, whether you have hypermobile Ehlers-Danlos syndrome, hypermobility spectrum disorder, is that we avoid further injury. So before you do something like this, before we do standing exercises, which are great for function, by the way, like if you're having trouble with stairs or just walking, one of the best things to do first is to go through a progression of mat-based exercises. So that would be something like the Muldowney Protocol, those first few levels where you're working on things like bridges, clamshells, ball squeezes, straight leg raises on your stomach, just to name a few. Or perhaps going to a well-trained Pilates instructor doing some mat or equipment Pilates like on a reformer in order to get that baseline strength. Once you've got that, after you've been working on that for a few months, it can be extremely beneficial to start working on some standing exercises because, you know, we don't exist fully horizontal, unfortunately. We have to at some point take that into function. So I want to introduce a couple ideas on how you can start to strengthen all the joints of your lower extremities, improve your proprioceptive awareness or the awareness of where your joints are in space, so you're able to walk better, do stairs, and just function as a human being. Now I want to introduce a few pieces of equipment that are extremely useful and cost effective. We use these all the time in the clinic. And one of the best is a full-length mirror. Because when you have a full-length mirror, you can start to see the organization of your body, especially when someone trains you on how to do it. The other kind of things that we use a lot are dowels. These are like those art dowels that you'll see. These are 48 inches long, and they have little end caps on the end. We've just bought these on Amazon, so you can use these for balance, and I'm going to show you exactly how we're going to use that. The last piece of equipment that is relatively inexpensive that I definitely recommend and has a million uses that we'll see shortly is an adjustable aerobic step. You can usually pick these up for like 20 to 30 bucks, even new online. And there's a gajillion of them if you go on Amazon or other online retailers or just go into a sporting goods store. So, and getting some adjustable steps, risers, because this will allow us to really easily progress these exercises, which you'll see in just a moment. So we're going to use the combination of the step and the dowels, and now I'm going to run through exactly what it is that I'm talking about so you can see visually the progression and how this would apply to you. So here we are with our dowels and our step. And when I look at most people, you know, most people want to be able to just function better in their daily lives, right? They want to be able to step, they want to be able to go upstairs, they want to be able to be with their children, be able to go on walks. So a step is an amazing way to do that. And using this in combination with the dowels allows you to avoid compensation patterns or using the wrong muscles while we're going through these types of progressions, which is awesome because then you can subtract dowels, you can add dowels depending on how you're doing that day. You can add or subtract height that allows you to make this one of the most adjustable exercises that I've ever seen in my life. So when I have the dowels out in the front, one of the first things that we're looking for is the alignment of the hip, the knee, the ankle, and the foot. And we want to try and do these in front of a mirror so we can see exactly what it is that we're doing. If we're practicing going up on a step like this, it allows us to watch in the mirror with our eyes, having a mirror in front of you, to see, is there any bowing of the hip out to the side? Is there a collapse of the knee, the ankle, and the foot? So you're working on two things at once, which is awesome, an awesome investment in your time because you're working on both strength and your mind-body connection or your proprioception of where those joints are in space. So when I come onto a step, I can use these as support. I can rock them with me, just like little windshield wipers. I can put my hands down onto them. They're not going to slip because I've got those dowel end caps on there. And I can just work over and over time to program that response and that strength. And then you could do the same thing on the other side. We'd switch legs. I've said this many times in some of our other videos. I always recommend when people are starting exercise that they start with time-based exercise. instead of reps, because we're trying to work up functional endurance. So you could start with whatever you can tolerate. Maybe it's 30 seconds of doing this per leg. And every couple days, as long as it's going well, you add another 10 seconds till you're able to do this for 2 or 3 minutes straight. Once you're able to do that, then you can progress to higher heights, or you can remove a dowel. A lot of times when I see patients, they're doing well with this, the next progression would be to see if they can just do that with the opposite dowel to leg that's up on there. So now I'm having to work a little harder because I don't have as much stability with the dowels to help me on both sides. The key though is that we always are able to maintain the alignment of our pelvis, our knee, our ankle, our foot, and the rest of our spine. If you were to subtract a dowel and you start doing one of these, or your pelvis and your ribs are shifting all out of place, we've lost that center line, then it's probably not time to progress yet. I would still continue to work that until you're able to maintain that midline. And eventually, we could start to add some height to these, which makes it significantly harder. The amount of progressions with these is only limited to your creativity, because we can also eventually add weights and things like that, and working on that step-up pattern again. So let's say this is particularly hard. We can add that dowel back in, and then again we can rock. Our arms are straight, our shoulders are down. We're keeping the arms active so they're not hiking up or staying out of our turtle shell. So when we rock, we're very anchored into those dowels the whole time. And then once again, you can subtract dowels as you get stronger. An average step is 7 to 8 inches tall. So we do want to go through, as long as you can tolerate it, as long as you don't have a lot of significant arthritis in your knees. Most people can tolerate up to an 8-inch step as they get stronger. But we don't only go up steps, right? We also go down steps. So it's also good to work on that forward progression, coming down off the step, watching again for, in this instance, the collapse of my right knee or my hip. Can I do that without that collapse? I also recommend that people work on what's called a lateral step up. And here's why. We're working some different muscles here. We're working what's called the frontal plane, where it would be like I put a sheet of glass through you like this, and then as we're stepping sideways, we're moving through that sheet of glass. Why is this important? A lot of our stability happens in this frontal plane where we're stepping to the side. A lot of times when we fall, it's because we step quickly and we don't have that stability to organize us from side to side. Think about if you're someone that has an ankle that collapses in, your arches collapse in. While you're doing that, it tends to move in that frontal plane. The arch collapse, the knee collapse, the hip collapses, and that's how we fall. So we want to make sure that as we're going through a progression like this, we have strong stability in this frontal plane. I'm keeping my arms active, my shoulders down. I'm watching. I'd be watching in a mirror while I'm doing this to see if there's any deviation in the hip falling out or the knee caving in. Again, these lateral step-ups, you can progress these with height and by subtracting dowels. And as long as you're not sacrificing that midline stability and you're able to do it with relatively low pain or discomfort. Physical therapy and exercise is not always totally pain-free, but there should be minimal discomfort. If you're doing exercise and there's pain or discomfort, then it may be too soon. It needs to be modified. And that's why I love the aerobic step with adjustable risers and dowels. There are many other uses for things like dowels and steps. That's just an introduction. Of course, if you'd like to see more examples like that, or if you like this kind of video, I'd love to have some feedback on it, because I'm definitely going to go on your guys' feedback and the kind of things that you're looking for. If you're hypermobile and you're looking for help with hip, knee, ankle, or foot pain, and you've tried working with your local physical therapist and you still haven't found a solution, check out our website. We'll put a direct link in the description below. We do work with people all across the United States, so there are online consulting options that may help you in the right direction. Also, we do have a community that we're building called Hypermobility PT. It's hypermobilitypt.com, and the point of that is to build community so people struggling with the same kind of things can get solutions and discuss the solutions that they found that's worked best for them. If you found this video helpful, it would mean the world to us. If you give it a thumbs up, a like, share it with somebody that you think would be beneficial. It really helps out the channel, and it helps out people that are looking for this kind of content. We look forward to seeing you guys in the next video.